During labor and delivery, our role as the anesthesiologist is to keep you comfortable and safe. We specialize in pain relief for childbirth. We work closely with your obstetricians and nurses as part of the delivery team to monitor you and your baby's well-being. When you arrive in labor, an anesthesiologist is always available to discuss pain relief options and answer questions. Our goal is to tailor a plan that fits your needs so you can focus on the birth of your baby while we manage your pain and safety.
Why is it important for patients to understand their pain relief options ahead of time?
It's great to learn about pain relief options before you're in labor. Knowing your choices in advance helps you feel more prepared and less anxious about the unknown. By understanding epidurals, breathing techniques, and other methods ahead of time, you can make an informed birth plan. Labor can be unpredictable, so it's good to have as much information as you can beforehand.
What types of medical pain relief are available at Northwell during labor?
At Northwell, we offer a range of pain relief options, and the choice depends on what you prefer and need. Some of the common medical options include epidural analgesia. This is the most popular option used by the majority of women in labor because it's very effective at relieving pain. We place a tiny tube in your lower back to continuously deliver medication that numbs you from about your belly button down. It takes about 10 to 15 minutes for an epidural to start working, and it provides steady pain relief that can be adjusted as the labor progresses. You'll feel numb in the belly and legs, but still conscious and able to push when the time comes. Spinal anesthesia, or a spinal block, is a one-time injection of anesthetic into the spinal fluid. It works very quickly and provides complete numbness from your abdomen down for a short period, about 1 to 2 hours. Spinals are often used for planned C-sections or if we need rapid pain relief for a quick delivery. We can give pain-relieving medications through an IV line, such as morphine or remifentanil. These medications take the edge off contractions. They won't eliminate the pain completely, but they can help you relax between contractions. IV medications can cause drowsiness, and if they're given too close to delivery, they might make the baby a bit sleepy, so we use them carefully and at the appropriate time. Nitrous oxide, or laughing gas, is an option at some Northwell sites. This is an inhaled gas you breathe through a mask during contractions. Nitrous oxide doesn't remove all the pain, but it can reduce anxiety and give a mild euphoria that helps you cope. Basically, it takes the edge off. You control the mask yourself, so you decide when to use it. It wears off quickly, and you're able to move and participate actively in your labor. Each of these options has its own pros and cons, and we are happy to discuss them so you can decide what's right for you. Often, we use a combination of methods to keep you comfortable.
Will an epidural stop me from eating, moving, walking, or pushing?
After getting an epidural, you'll need to stay in bed and typically can only drink clear fluids. It can make your legs weak, so for safety, walking is not allowed after it is placed. You won't feel the urge to urinate, so a small catheter will be used to empty your bladder during your labor. Epidurals do not stop you from pushing. You may feel contractions as pressure rather than pain, and your care team will guide you through when and how to push.
Is there any reason I wouldn't be able to get an epidural? Can it be too early or too late?
Your anesthesiologist will check your lab work and medical history to make sure it's safe for you. Epidurals can be given at almost any point in labor. There's usually no too early or too late.
Will an epidural increase my chances of needing a cesarean section?
No, an epidural does not increase your risk of a C-section. In fact, if you do need one, having an epidural already in place can reduce the chances of needing general anesthesia.
Will an epidural harm my baby?
No, epidurals are very safe for your baby. Unlike IV medications, very little medications from the epidural reaches your bloodstream or your baby's.
How is the epidural procedure done? Does it hurt?
The procedure is done right in the room where you'll give birth. You'll receive a small numbing injection in your back. It feels similar to an IV or dental numbing. Staying still helps make it easier and faster, but small movements aren't dangerous. Your doctor and nurse will guide you. After placing the epidural, the needle is removed and a thin plastic catheter stays in your back, taped in place so you can lie comfortably.
Can my partner stay with me during the epidural procedure?
It depends on your hospital's policy, so be sure to ask your care team in advance.
Will an epidural affect my ability to breastfeed?
No, an epidural will not interfere with your ability to breastfeed your baby.
What if I move or something goes wrong and I get paralyzed?
This is a very scary thought, but extremely, extremely unlikely. Permanent paralysis from an epidural is exceedingly rare, on the order of 1 in many hundreds of thousands.
Can an epidural cause a bad headache?
About 1 in 100 women may experience what's called a spinal headache after an epidural. This can happen if the epidural needle unintentionally goes a bit too deep and punctures the spinal fluid sac. If you get that headache, which is usually positional, worse when sitting up, we can treat it. It's almost always short-term and resolves completely.
Will I have back pain afterward?
You might have some soreness at the injection site for a day or two, kind of like you had a bruise or a sore muscle from a shot. But there's no evidence that epidurals cause long-term back problems. In fact, many women experience back pain after pregnancy and labor simply from the pregnancy itself and the strain of labor, with or without an epidural.
When can a patient request an epidural during labor?
You can request an epidural whenever you feel you need one. The best approach is to communicate with your nurses and doctors about your pain. If you're thinking you might want an epidural, let us know early so we can prepare and ensure we have someone available to place it when you're ready.
How can breathing help manage labor pain? Can you give examples of techniques?
Breathing techniques are a form of natural pain relief. They don't make the pain disappear, but they help you cope with it better. One way they help is by providing a focus. Concentrating on your breath gives your mind something to do rather than dwell on the pain. This can actually change how you perceive the pain, making it more manageable. Breathing also triggers the body's relaxation response. Let me share a few examples of breathing techniques you can use. Slow-paced breathing. This is a basic and very effective technique. Breathe in slowly through your nose, and then exhale gently through your mouth. Start and end each contraction with a big cleansing breath. A slow deep inhale, and a sigh out to reset. This slow, rhythmic breathing maximizes your oxygen and signals your body to release tension. As contractions get more intense, some women like to use a faster pattern breathing to ride through the peak of the pain. Pattern breathing involves a set rhythm, like a series of shorter breaths, followed by a longer exhale. For example, you might do something like this: he, who. Your support person or partner can help by doing the pattern with you or by counting. Visualization breathing is a technique that pairs breathing with your imagination. The idea is to use mental images or phrases to help you stay calm and positive. For example, you can close your eyes as you inhale deeply. Imagine you're somewhere peaceful. Another approach is to visualize the contraction as a wave that you are riding. You breathe in as the wave rises, breathe out as it falls. Or think of each contraction as bringing you one step closer to your baby. With each exhale, visualize that progress.
Lastly, what is one key message you want patients to remember about pain management and how your team supports them?
I'd like patients to remember this above all. You do not have to be in pain during labor. If you want to try an unmedicated birth, we will support you in that too. We have many tools and methods to help you manage your pain, and we will tailor our approach to what you need and prefer. Our anesthesiology team's whole mission is to keep you safe and comfortable, and we're here by your side every step of the way. In the end, our goal is a healthy mom and baby, and a mom who feels she is cared for, heard, and kept comfortable. The key message is that you have options and that you're in control of your labor experience. Thank you. We hope this Q&A has been helpful. Remember, you can always talk to your healthcare providers at Northwell Health about any of these topics in more detail. We're here to ensure you have a safe, comfortable, and supported birth experience.